Good day, everyone. My name is Olayode Oluwafikemi. I'm a marriage counselor. I use this opportunity to appreciate the founder of this foundation, Stop Mental Illness Foundation, and all the organizers of this great event. I thank them for honoring me and for giving me the opportunity to be part of this year World Mental Health Day. Thank you so much. I believe that after the completion of this workshop or training, all of us will be enriched. This year theme of World Mental Health Day is mental health is a universal human right. You are worthy of happiness and peace of mind. There's no shame in seeking help for your mental health. You are not alone. Ask for support when you need it. The topic before me is mental health in relationships, breaking the stigma together. And the outlines we are treating together are the intersection of mental health and relationships, recognizing signs and symptoms of mental health challenges, effective communication strategies, destigmatizing mental health within the family, seeking professional help, and lastly, we are going to talk about real life stories and cases. When we are talking about mental health, we are talking about a person's emotional, psychological, and social well-being. Let me start it this way. Some years ago, I had a friend. We were living together in an apartment. This woman in particular, when she was in higher institution, in one of Nigerian institution, she was in a relationship with a guy, and later, in maybe 2 years after they have started the relationship, the guy traveled abroad. About a year when the guy traveled abroad, this woman now heard the story. I don't know how she got it, but she just heard that the man has married where he traveled to. This woman could not rely or tell anybody or relate the story or the problem to anybody, even including their friends that they were moving together at that particular time. She bottled it up. She bottled it. And this problem now later affected her education to the extent that she has to have extra year when she finished her education. And this thing continues. At times this problem now led to her not to socialize with people again. It later lead to anxiety, frustration, and later what people now discover was that she was hearing some voices, hearing people calling her. People now think that maybe is maybe spiritual something or whatever. But later, when a family member now discovered that this is what is happening to her, she was taken to hospital. But it was too late, because by that time when the help came, she has developed hallucination. So that is what we are talking about. Mental health in relationship. If we don't handle it the way we're supposed to handle it, and it generates to another level, it's going to become a problem to the individual and to the people around that individual. This mental health that we are talking about, it can affect the way we communicate, the way we make decisions, and interact with other people. Like the story I just narrated, this woman refused to tell people, and it affected her communications and the way she relates with people, because since that time that the problem started, she started withdraw herself from people and she became isolated. So even the friends that she relate together, she abandoned them, and this thing continues until the problem generates to another thing. When it comes to mental health in relationship, especially in marriage settings, it is very difficult for the couple, each of the couple, to know when the other partner is having mental health issue, because at times the other person may not know, because the first thing is going to affect is the person's reasoning. The person will not be able to reason well, and this will affect the decision making, and it will later affect how the person interact with people. When it comes to issue of depression, this is the highest level of mental health issues or challenges, because at this time it has not become a disorder. We should know the difference between challenges. It means the person is having issues, problems that can be helped. But when it becomes disorder, that one has generated to another level, and it will require the interventions of some professionals for that individual to come out of it. But I'm talking about the challenges, the issues that our mental health can bring if not handled with care. And the reason we are saying all these things is that in a relationship, because that is the only place, the first place that we can know maybe someone is having this mental illness issue or challenges that can be quickly be uh, amended, be resolved. That issue that we are talking about, if it's not handled very well, it can lead to negative impact on our social and cognitive functioning, because the individual will be having low or decreased energy level. It can even affect our motivation. The person will not be motivated to do things again, and the person will now lack motivation to do things and to take care of their health. At times, some individuals that are having these challenges, they will have problem in their eating habit and sleeping habit. At times, these people in relationship, the man and the woman that comes together to form a family, they may have so many things in common. When they are into courtship, they may try to patch some behaviors that even the other person may not know that the other person is having these kind of issues or challenges. And as they move on in a family, now they are no more two, they are one. This thing will now start coming up. Maybe the man is someone that is very quiet, and the woman, maybe she's the kind that is very lousy. Maybe she likes talking, she likes to relate, and the man is a gentle type, the one that used to keep to himself and do his own things in his own way. The woman may now be thinking, what is wrong with this man? What is wrong with my husband? And if they don't address the issue at that time, this thing may continue until they have children, or especially the first issue, or the firstborn of the family. So when this one thing is now continuing in the family, the first child will now be thinking, who will I move closer to? Is it my quiet daddy or my lousy mommy? And even in the school, he will have some friends, peers that he may be relating to. Assuming the child now move closer to the father, the quiet one, in the school, he will now make himself to be isolated, doing his own thing in his own way. And when we look at it in school settings, these are some of the things that made some children to bully one another. So this thing can continue till the child will now be thinking, what is wrong with me? I don't know how to socialize with people. And when he has problem, he won't have anybody to talk to. He won't have anybody to relate his challenges or issue to. This thing can now move to anxiety, to make the child to be hostile. The child may be hostile. It may even affect his academics. That thing can continue until the child, because not only in the couple's life that we can say mental health challenges, it can happen to the children also, because the children at times they have it at home when the father and the mother are not in good term with each other. Maybe they're having misunderstanding, The child may be neglected. The child may be isolated, and the child will have this uh, trauma within him. So these are the negative effect of mental health issue if we don't address it when we're supposed to address it. And let me now bubble your balloon. We cannot do away with mental health issue because we are human being. What we can do is that we can manage it. We can adjust our life to suit the purpose that we will not have this mental health issue. That is the purpose of this year, World Mental Health Day. That mental health is the right of everybody. We must be our mental health should be stable. We should have a healthy social life, and our thinking should be stable. That is it. Now let's move on to signs and symptoms of mental health issue. How are we going to know? I said it earlier on that at times in a couple, the other partner may not know that the other person is passing through issues. So how are we going to know? What are the signs that the person will know? Or even in friends, when you have a friend that is very jovial, very enthusiastic before, and the person now just withdrawn to himself, how are we going to quickly discover to help the person to come out of the issue? The first thing that we are going to take note is the emotional disturbance. The person may have this mood swing. Is laughing the other time, and this time he just frown. You will discover that something is going on in his mind. He's nursing some thought. He's having some issues within him. That is the first thing that you are going to know, that this person is passing through some challenges. And the emotions will change. It may even lead to anxiety. The person that is always jovial, laughing type will now be thinking, how am I going to do this? How am I going to get this thing done? How is this thing going to be? And if the needs are not met, it will now generate to frustration. The person may be hostile. The person may change from whom he or she is to another person entirely. And this will now lead him to become angry person. He'll be very angry. When you say a thing, he will now turn to person that will now twist word, because what is happening within him is not what the other people are perceiving. So this person is having mental health issue. And when immediately we discover that this thing is happening to a friend of ours, or our partner, or our spouse, or even the children, we should quickly help them. We should quickly assist them to come out of it. Another one is changes in behavior. As I mentioned the other time, the emotional disturbance. How are we going to know? It's through their behavior. They will have irritability, and they will withdraw, and some of them will now isolate themselves. They will not want to talk to people. They will not want to relate with people. And if it is in family setting, the love and affection that they have towards each other will start decreasing. These changes in behavior can make the members of the family and even the children to seek assistance from elsewhere, or the children may seek succor from their friends, which may now lead to another problem entirely. We can say that our society nowadays are filled with children with peers influence. What happened? It starts from home. Assuming the parents are there for them, assuming the parents can engage them, talk to them, know what is wrong with them, what we are having in our society today will be minimal. And if we want to eradicate it, let's start from home. Let's start from our family. Another one is communication issue. They will have difficult in the way to relate with people. They will not want to put their pressure on others. I've had some people before. They will say, if I tell him my problem, he may go out and publicize what is wrong with me. So this person, because they see this mental health issue as problem, they will like to bottle it up and let the problem be within them. They will not want to communicate. They will now be thinking it. And is the level of what our brain can contain is very little. When it's is blown up, it can lead to another brain disorder, and the law will help us. Because they have problem in how to relate with people, they will not understand people. And because of this, other people also will not understand them. And this now may now lead to assumption. It will lead to assumption, and it can lead to breakdown in relationship, especially between friends, between couples. The misunderstanding can progress to frustration and conflict. When you have some couples, what usually cause the misunderstanding and conflict in the family, you will know that it is this thing that we are talking about: assumption, misunderstanding. And because of this, even the person that is having the problem will not be helped, because the person that will help them does not know what is wrong with them. Another one is social withdrawal and isolation. Mental health challenges can make people to withdraw from social interaction and social gathering. You will see some people on Saturday, before they have these issues, they don't stay at home. They are into Owambe or parties, birthday parties. They like to socialize. But immediately these issues start with them, they will not have interest in going out. They will like to stay at home, to stay with even to talk to the family will now become a problem. And this mental health issue can affect the couple to avoid physical intimacy. You understand what I mean by this? It will affect them, because when one is not happy, the other one will be thinking what is wrong with the other man. And because the person that is passing through issues does not know how to relate what is wrong with him, he may not be willingly to have intimacy with the partner. And the impact of this can affect the other members of the family, as we all know. And people with mental health issues, at times, it may lead to depression. This depression may not allow them to move around. And people will now be looking at them or seeing them as someone that is not normal. Like someone that is not maybe from another world. From another world. So depression is not good, and it can affect our social lifestyle. Mental health challenges can also affect couples to abandon their life goal setting, their life goals, their dreams, because they will not be motivated to do things, even to pursue their careers. Some people, after marriage, they have it in mind that they will further their education, or they will go into one trade or the other. But because of depression, because of frustration, because some of their needs are not met, they will be depressed. They will not be motivated to pursue their future career or to even pursue their dreams. So this thing has been affecting people, and is part of what we need to address as a counselor, as a parent, as an individual, that before this thing will generate to another thing, we should try and help these people to come out of these challenges. And the only thing we can do, the only thing we can use to help them is to be with them. Be with them, talk to them, even if you cannot assist them, maybe counseling or other thing. You can lead them, talk to them, don't isolate them, relate with people, ask about their well-being, ask about their life, about their work, how they are doing things. You may say, I want you to intrude into their personal life. No, what I mean is relate with them, talk to them, ask about their well-being, and this thing can even help them even to come out from the depression or the frustration. And if they have mind to relate what is happening, problem shared is half solved. By this, all this problem that we're having in our society can be minimized. So let's talk about the effective communication strategies. There's no way we can talk about mental health issue, how to come out of it, without communication. The person needs to talk to let the person that we help, him or her, to know which area to come in. Effective communication. We have so many strategies that we can use to help those people that are passing through mental health issues or challenges. Effective communication plays a vital role in coming out of mental health issues, and even if we want to help them. The first one is we should encourage the person, the individual that are passing through mental health issue, to express their emotion openly, to express their emotion. Because it is when they express their emotion that we will know what is happening to them. They should try not to bottle up their emotions. Don't bottle up your emotion. It should be our logo. Express your emotion. Say it out. Especially in relationship, with spouse. If you are passing through anything, talk to your husband. Talk to your wife. Even the children, when you are passing through what is not convenient, what you don't like, say it out. Say it in the way that you know that people will hear you. Come out and say something. Speak up. Don't bottle it up. So the way to express our emotion has a very important role in coming out of mental health issue. This can be done through many ways. You can say it verbally. You can talk to people. You can make phone calls. And social media is helping us nowadays. You can chat it, send it to people, and people will respond, and you will come out of it. If you look around yourself and you see that the people around you are not the one that can help you, maybe it's a secret that you don't want to relate. And also, you can talk to counselors. Counselors are the skill to keep your secret. We have this thing called confidentiality, and that is the bedrock of our profession. If you talk to a counselor, your secret is a secret. It will be kept for you. And as you relate what is wrong with you, you open up, you say it out, you will be relieved. Even the burden will be lifted. Another one is active listening. This one goes to those people that may want to help people that are passing through mental health issue. Active listening. You listen to what they are about to say. You listen to what, even if they are stammering, listen to it. Don't jump into conclusion. Because the reason why many people doesn't want to confide in people is because immediately they start narrating what is wrong with them, people will start judging them, castrating them, saying all sorts of negative things about them. Listen, have active listening. Have the ears that can listen. And as you listen, at times in counseling, we have seen it, that it is when these people are explaining what is wrong with them, that they themselves, they will have the understanding of the solution to their problem. Because as they are saying it out, they too, they are listening to what they are saying. They are pouring out their minds. They are pouring out the problems. The solution may be coming to them. And at times when you ask them, what do you want me, where do you want me to come in? They will tell you, I've seen the solution. I know what to do now. Why? Because they have poured out their mind. So don't judge them when they are talking, when they are telling you what is wrong with them. Don't judge them. And don't say, it's too much. Or, this thing is, I can't take it. Don't have the empathy. Have the empathy. Put yourself into their shoe. And with this, they can come out from the problem. And in a family setting, this goes to our parents. Please have listening ears. Listen to what these children are saying. Because some parents, especially with the little children, the toddlers, the adolescents, if they come to their parents, mommy, this is what is happening in my school. The mommy will say, oh, don't disturb me. I'm busy. I want to rest. I want to do this. Or the father may even say, oh, I've gone out from the morning. I just come back to come and rest. Don't disturb me. And this thing has led to so many children to make mistakes. The mistake that it is the parent that will now be solving it later in life. So let's have listening here and the shoulder that they can rest on. This will promote understanding. And as we talk to people and the people who are relieved of their problem, there will be connection. And this thing will now help them enhance their mental health the more. Another one is seek help, seek support. When you are passing through what is not convenient or comfortable with you, seek help. Come out. There is help. Help is available. Seek help. Don't hesitate to ask for help when you need it. Communicate your difficulties and seek good counsel. Talk to people that will understand you, that you can trust. Talk to them. And if you see nobody around that you can rely on, that you can relate your problem with, I've mentioned it earlier. Take your phone, type it. What can be done? What can I do? And the solution will come and you will be relieved. Another one is that this goes to those people that want to help. Do away with assumptions and judgments. Do away with assumptions and judgment. Misunderstanding can arise from assuming what other people thinks. You assume, is it thinking about this? Don't assume. Embrace empathy. Have empathy with them. And as you are doing it for the member of the family or to your friends, they will like to relate more with you. And this will reduce you from making hasty judgment about what other people are passing through. Don't judge them. The situation and their intention may be different from what you are thinking. Don't jump into conclusion. Now we are going to the main theme, the main topic of this seminar. That is destigmatizing mental health issue in the family. How are we going to remove this stigma from the family, from the relationship? At times when you see people that says that they want to go and see psychiatrists, what usually comes to our mind is that this people is having mental disorder. And don't let me tell you, mental disorder is different from having mental issues or mental challenges. It's only when you don't take care of mental issues and mental challenges that it can aggravate to mental disorder. But before this thing come to the issue of being a disorder, we can remove it, we can minimize it. So how are we going to destigmatize it? How are we going to break the stigma from these people that have mental health illness or mental health issue in the relationship? The first one is that to break mental stigma of a mental health with the family, we need to educate ourselves. We need to be aware. We need to educate ourselves that everybody is prone to have mental health issues because no way, no how we think. We have what we are thinking about. We have aspirations. We have plans. And the way we are thinking is different from how other people are thinking. Some people, they will think and they will leave it. Because they can't do it, they will say that what they cannot do, they will leave it. But other people, they will stick to it until they get the solution they are looking for. So the way we think differs. So when we now see people that are prone to deep thinking, this can lead to frustration because not all what they are thinking or what they are expecting will come as they expect it. So how are we going to destigmatize this? The first thing that we need to do is that there are so many myths, so many misconceptions about this mental health issue. I said it that when people are saying they want to go and see psychiatrist or they want to go to psychiatric hospital, people think they are mad, they are insane. Especially if that people is behaving somehow. Not everybody that visit psychiatrists are mad. Not everybody, not everyone that are visiting counselors are insane. What they are looking for is help. And when help is available, we should try and grab it. Another one is that they thought that when people visit a psychiatrist hospital, they think they are incompetent. They are incompetent. They are irrational. They cannot think rational. They can't think straight. Even some people, they have turned it into slang nowadays. You will hear people saying, my mental health is not stable. I have issue with my mental health. What they are saying is that they are not saying that they are mad, but they are telling you that they have so many things that they put in their mind. So mental health issue, no matter how tense or how difficult we see it, it can be helped. We can come out of it through the help of the professionals. And another thing is that after we have removed the misconception and the myth, we should try and promote understanding through awareness and education. Share resources. Tell people about how to come out of it. Tell people about how to calm down. Tell them, calm down. Take it easy. That is counseling language. Calm down. Take life easy. Calm down. And first thing is that you must first of all educate yourself before you can educate others. Because what you don't have, you can't give to other people. So you promote education and awareness. And as I've mentioned earlier about the story of my friend, when I know this family, the first day that the woman exhibits this behavior, I was shocked that how can a beautiful woman like this behave in this psychosis manner? Because then I was not aware of this mental health issue. And I called one of the children. She was the one that explained to me that they are trained how to relate with their mom, how to help her anytime she's having challenges, when she's having crisis. And I now asked the lady, how will you know? And the woman, the girl told me that anytime the woman did not take drugs, the grandma has instructed them on what to do and what not to do. And this thing helped the woman a lot. It helped her a lot. So be educated. Let's be educated. Let's tell people, as we are celebrating this World Mental Health Day, let's tell people, let's educate people, let's inform them, let's remove the stigma that not everybody that is having mental illness or mental health challenges are mad. No, they are a human being. They have this right to be called human being. And another one is encourage and support the environment. When you see people that are behaving somehow, behaving irrationally, you can talk to them, you can walk up to them, talk to them. And if you don't have anything to give them as a therapist, you can help them to see one. Help them to see the person that will help them. And this one will help our environment to be free of mental health illness. And this comes to the family. Assuming we have a child that is behaving somehow, don't let us close our eyes to them. Let's help them. We can encourage them earlier, because if we help them earlier, it will help us and help them also to quickly come out of the challenges. So as parents, as mothers and fathers, and as children also in the family, anytime we see someone behaving somehow behaving irrational or having this irrational thoughts or behaving somehow, we can help them to come out of it. Then allow the individual with mental health issue to engage with other people that are having this challenges that have come out of it. We have a lot of people that have this issue and they have come out of it. Let's introduce them to them. They will tell them how they have done it, the steps, the process that help them to come out of the problem. Another point we are going to talk about is seek professional help. I've been saying it. Don't hide it. Don't bottle it up. Seek help. Help is available. Seek counsel. Tell people what is wrong with you and you will be relieved. And as the theme for this year, World Mental Health Day says, mental health is a universal human right. And you know that mental well-being is everyone's right. So whenever you seek help, you need help, seek help and you will receive help. And these professionals, they are there to help you. We have the counselors, the therapists, the psychiatrists, even our religious leaders at times, they can help. In the family setting, look for help. Don't bottle it up. Say it out, even if they will judge you, even if they will misinterpret you. Say it and relieve the burden from you. The benefits of it are many. We will have emotional support from counselors. These people, they will help us because they have listening here. They will help us to come out of the problem. And through this, our feelings and thoughts will be made right. This professional will offer empathy, guidelines that will help us to come out from the problem. Then another one is that this professional, they will help such individual or family to develop coping mechanism strategies. They will teach us how to communicate our issue to the person that we need to communicate to. Maybe you're having problems on how to relate to your husband or to your wife or to your friends. The counselors can give you guidelines and steps in a better way to talk to these people and to relate with them. And this will help us to be resilient. And we will be able to manage the symptoms and the stressors that may come out of the mental health issue. And if you are passing through these challenges, this is very helpful. If you know that these challenges has weighed you down than what you can imagine, please change environment. Go for vacations. Do things that will give you joy. Do things that will bring joy to you. Be happy. You are the one that can make yourself happy. Nothing in the world can make you happy. Do things that will make you happy and that will restore your joy. Your joy is your strength. Change your environment. Go for vacation. Take holidays. And by this, the mental health challenges can be reduced. And the next one is the treatment package. This treatment package can be done by the professionals, the counselors, the therapists, the psychiatrists. The first one is psychotherapy. This psychotherapy is a treatment package to help people that are passing through difficulties in life. And we have something like CBT. This is cognitive behavioral therapy. We have exposure therapy. We have RET, rational emotive behavioral therapy. All these things can be done through these professionals to help us to come out of the challenges. And another one is hospitalization. This hospitalization is when the challenges has gone extreme, when it has reached a level that we cannot handle it alone. At times, we may go to hospital and the psychiatrist may ask you to wait. Don't say, am I mad? Am I this? They want to admit me. Am I this? Am I that? They want to monitor you. They want to monitor you to know how to help you out of the problem. So don't refuse hospitalization and don't refuse medications. If you are being given medications in the hospital, I know counselors will never give you drugs. I know counselors will never prescribe drugs for you. But when we are talking about these psychiatrists, they have been trained to administer drugs and counsel. So if they give you drugs, take it. This my friend that I'm talking about, the only time and every time she's having crisis is when she refuses to take her medications. So if you are on medications, take it. This mental health issue is not terminal diseases. It's not everlasting diseases. It's something that you can experience and later you come out of it. So if you are being asked to take medication, take it. These are what will help you to come out of it. And in our environment, if we have people that have come out from this mental health issue, we can form an association. We can form a group to help others that are passing through similar challenges. Then this thing goes to our government. They should integrate mental health clinic into our hospitals. Although it's there, but they should empower them more so that in every hospital that you go to, we will have professionals that will handle cases that relate to mental health issue. Now, let's move to cases. Something happened about a week ago, or going to 2 weeks now. I lost one of my mentors. He was a good man, a nice man, good husband to the wife. You ask me how I know. It will show, because you cannot hide it. If you are good, you are good. A good father to the children, because at times when he's talking to us, he always talk about his family, his children, his wife. We just discovered that he died in his office. What killed him? He played in the morning with people, talked with people in the morning. But what happened? He has these bottling challenges, these mental health challenges. Although he is a man that can help himself. But when you discover that this thing has gone overboard, seek help. This man refused to come out straight until after he died, that people will start talking that this man, a good man, but he has this thinking, always thinking. Don't think alone. Don't carry this burden alone. Release yourself. Release yourself and let people help you. And if there is relapses, you can go back and take the counsel again, because there may be relapses, especially in our country nowadays, that things are very expensive. You may be thinking, how am I going to do this? How am I going to do that? How am I going to solve this problem, this financial crisis? How am I going to do it? There may be relapses. What do you need to do? Go back to the drawing board. Take counsel again. And that is how we are going to live this life until we live it. So we will be having expectations. And most of these expectations may not be met. So as we are going in life, some will be met and some may not. So what will you do? Keep on. Keep on in life. Don't wait until when after you have gone that people will now be lamenting. You will now stay up yonder and be thinking, had I known, I should have seek help. I should have told people. I should have informed people. Don't let it come to that. Talk to people. Seek help. Let them help you. Help is available. There's nothing in this world that should take your peace, that should take your rest of mind. Seek help and you will be relieved. In addition to what I have mentioned, if you see anyone battling with mental health issues, don't judge them, as I've mentioned earlier. Motivate them to seek help. And remember, you are worthy of happiness and peace of mind. There is no shame in seeking help for your mental health, and you are not alone. Ask for support when you need it. Thanks for listening.